ophthalmologist, eye specialist, or bone specialist, or the specialist referring subarachnoid hemorrhages, neurosurgeons, and medics if the patient's CT is negative. If you have any question, ask me question now. I'll give you 10-minute break. We'll be seeing you at 11:40. Zabda, you have any question? Hasham, you have any question? Fatima, Noor, Sadia, Dr. Foon, Manju, Anna. If you have any question about any headache, ask me now, please.
Will we get these notes in the WhatsApp group?
Yes, so we will be doing ebook. So the algorithms, we will do the audio. We are recording few of the things, and we're recording our full course, the recorded course. You will get the videos with these algorithms, but ebook you will get in the form of book. But algorithms we will might give you in the form of very short video, 6 to 7 minute videos. Who will be taking course with us, and we will upload, and you will get access to those videos.
And when will we get this ebook?
So the ebook you will get, we'll keep sending you ebooks. So first in next 1 or 2 days, you'll get the ebook for the history, data gathering, and approaches. Then you will get unit wise, CNS, CVS, separate ebooks. You will get it, those in which we'll do that heating problem. Cooker mean like a cooker, what we call cooker, or a burner, or whatever we call it, gas system. Any problem with that, because that can cause carbon monoxide, and you can ask carbon monoxide. So take a quick break. At 11:45, I'll see you guys back, and then we'll do few of the scenarios. I'll show you a few of the scenarios from headache, and we'll do few the leftover of from the previous scenario. In the meantime, I'll ask you, few of the doctors will be coming, and we'll do some simulation. As I mentioned, I'll show you some simulations from the different approaches as well, like Noor said, breaking bad news, refusal structure, difficult colleague. So we want to show you those simulation in the start, so that you will get an exposure that how will you deal with the difficult scenarios in PLAB 2. If you have any question, keep asking. 11:45, I will be back. Take care. What I'm going to do now, I'm going to cover few of the scenarios which might be you able to see in different headache conditions. So I'm going to share my screen now one by one. So I'll show you one by one all of the scenarios related to the headache. So if you get that scenario, how would you approach that scenario? And we'll do one by one. Okay. So I'm going to share my screen now. So yes. So you can see my screen now. So let's start with the acute sinusitis. So in the acute sinusitis, the few of the positive findings you might see would be like this. 31-year-old male has been made an appointment to see you. You had a cough, flu, runny nose, and fever last 4 weeks. And in the last 4 days, you had a headache between your eyes. The headache is the headache is worse on the left side, and the headache is worse. So that might be giving you an impression that headache is unilateral. But it can be unilateral on the sinusitis as well. The headache is worse when you bend forward. When that patient would be bending forward, the headache is worse. You have some greenish discharge. That means that headache is got like a sinusitis got infected. Examination finding percussion, tenderness on the maxillary sinus, greenish nasal discharge. CT scan result. If it's A&E setting, or if they advise you to do the CT scan, they might show you inflammation of maxillary sinus. In most of the settings, you don't need to do the CT scan. So the positive finding could be this way. This positive finding you need to know the runny nose, fever, greenish discharge. So you will be giving antibiotic like we discussed before. So this is what is about the acute sinusitis. So how the carbon monoxide poisoning scenario would come, how the carbon monoxide poisoning scenario. So 18-year-old girl has made an appointment to see you. She has had headache for 1 month. So it's a long time. So ice is one of the things. 4 out of 10, throbbing bilateral. It will like say, doctor, it's a throbbing, but it's not too much. But it's a bilateral. No issue at work, so there is no stress headache. She get a headache when she's at home. That means this is a trigger point. Whenever she go home, there are the 2 trigger points. So if you ask who's at home, so don't think that way, that my husband or my wife gave me headache. No, I mean there is something physical, something there which is something which is giving headache, like carbon monoxide poisoning. Her symptoms started when she moved into her new home with friends from university. So there is an ongoing issue in the home. Her friends also have been complaining of this headache. No allergy symptoms started in the new home. So when she shifted in that house, that time the symptoms started. This is carbon monoxide poisoning. And how would you manage it? I already told you that high flow oxygen, ABGs, you will do the blood gas, and you will offer paracetamol, you offer him pressure, change home. So the number one thing is don't go into the home. Don't let your friends to go in the home. Try to get the things get fixed through your landlord, or get some help from the social services or occupational health as well. So this is carbon monoxide poisoning can show up. GCS scenarios, how it can come up. So 60-year-old woman referred to the hospital by GP with a headache. So it's like a rheumatology, presented to the hospital with the headache for 3 weeks. So basically is already referred to the rheumatology. So you should think about of GCA. Presented to the hospital with a headache for 3 weeks, has been taking paracetamol, but with no relief. You're also not able to see properly with your right eye. So she got eye symptoms. So when there's eye symptoms, what would you do? If you got eye symptoms, what you would do? Sorry.
I refer to the ophthalmologist.
Yes, urgent referral. So in this scenario, you will go for the urgent referral straight away. You would refer that patient straight away for that. Okay, so urgent referral. Properly with the right eye for 1 week. You have no weight loss. You have muscle pain on your shoulder. So I told you the muscle pain, tenderness, when you'll examine tenderness here, tenderness here. So it is a GCA. You have no weight loss. You have muscle pain on your shoulders, thigh. You do not feel sick. You have no weakness. Okay. So this is GCA scenario. The GCA scenario might come that way. So you should have a simple idea that how the scenario would come up and what could be the positive findings in the Meptosa. So let me tell you where you will find these findings. It's not like you not get information for free. You have to ask for it. How would you ask? You go into the history. So you will do the Socrates, you'll get this 3-week history. Then when you go to the other part, examination, you get few findings in the examination. You'll get few findings from that in the past medical history. You will get rheumatology or something like that. So this is GCA scenario would come. Hangover headache. Hangover headache. So I told you, young patient made an appointment with medical student care center. This morning you woke up with a headache. So this would be the complaint. Doctor, when I woke up in the morning, it was headache. Yesterday night, what he was doing, headache started 3 hours ago, throbbing. 9 out of 10, that headache is too much. Wearing dark glasses, because don't get panic by that is wearing dark glasses is like glaucoma or something like that. Your history will tell you what it is. So don't think it would be dark glasses or something, but they might distract you few of the information. Yesterday you were at a rugby match and you went to the pub to celebrate. So they won the rugby match and after that you celebrating. So that could be any sports match and then after that you was celebrating. So the main thing is that the patient was in the pub and he or she had a headache, drank a lot of alcohol. So you'll take alcohol history. So you will take alcohol history. You will tell that you are normally fit and well. So there is nothing in the Meptosa apart from this. Apart from this headache, you'll get this. Her friend told her that she could have alcohol poisoning. So friends told that she would have alcohol poisoning, mean that he might drinking too much alcohol. The headache is generalized over the head. So in this way, how would you treat that? How would you treat that? Yes, guys, how would you treat that? So I'll quickly show up my sketch again. So I already showed you that sketch for the headache. So you will ask all of the history points here again. When you'll go to this part on the Meptosa, if you go on this part Meptosa, she will tell it's alcohol and make it dark. Alcohol. She drink too much alcohol. Yesterday night, he was in pub, but in the morning, the headache came on, and it came on for 2 to 3 hours, and it's very severe headache. She might be dehydrated. She might not be drinking well. So what would be the treatment for this? Hydration. If you go for the treatment again for the hangover headache, plenty of water, alcohol services, control hypoglycemia, eat well, vitamins. We can give you some vitamin B12 or the alcohol cessation group, because you have to take the history. She would tell that, doctor, I'm having this for a long period. So this is how you will manage hangover headache. But you need to know that how you would differentiate it from the other headaches. So that's done. So now meningitis. Meningitis do contain with headache as well. How would you rule out meningitis? Let me quickly show the headaches part again. You'll take the history again. So in the management part, what positive? Where you will get the positive? So the patient would say headache along with the neck pain. The patient would say it's worse. Light is hurting me. Yes, doctor, I might have noticed rash. Doctor, my neck hurts. But yes, doctor, I'm vomiting. These are the positive findings. Yes, doctor, I'm vomiting. Doctor, she would say headache is related to muscle aches. She would might have some muscle aches as well, but not no alcohol history, nothing like that, but she might be having fever. So when you go to the examination, the patient might have temps like 38 to 39 degree. Okay, so in this way, the patient might have meningitis as well, migraine for moderate, episodic, unilateral. So you have to rule out everything. for that the meningitis. So in meningitis, 25-year-old woman who has presented with a headache, you have got pain all over your head. The pain started gradually yesterday, and the pain light is bothering you. So whenever the light is bothering you, either it's a migraine. If it's a migraine, she might not having any fever or nothing. So when you will do the what positive finding you'll get. Brzezinski sign is positive, Koenig sign is positive. So you will do the movement on the neck. You will find it's painful, feeling feverish, has a rash on examination. You live with your parents, you work with the travel agents. So what would be the treatment for the meningitis? You'll keep the patient, start IV fluid, do the CT scan, and we'll decide about the antibiotics after on. If it's bacterial, you will start with the antibiotic according to the protocol of the hospital. So this would be the management for the meningitis. So for now, we are going to do one headache scenario with Dr. Ibza. I'll tell you the story, what to ask. Yes? Yes, you can. So have a seat. So if I'll give you, can you make this little more setting? Yes. So you can choose any of the headache scenario. Okay. Let me make this chair a little up. You have to speak a bit louder. Let's do a headache scenario in which I'll give you a few. Yes, come here. Come slightly here. Good. So this is Dr. Ibza. She is one of the A&E doctors. So everybody can see us. Let me turn off my screen. Stop sharing. Okay, you can see now. Okay, so Dr. Ibza, basically we have done a couple of headache scenarios. I'm going to show you now. So you choose any one of these. So we got migraine, we got subarachnoid hemorrhage. In subarachnoid hemorrhage, let's start with the subarachnoid hemorrhage. You would be having a severe pain, and there are GC as well. So whatever you like to choose, you don't need to tell me whatever you're choosing. Okay. These are the stories. All of these stories are here. So either migraine, whatever you can simulate best for headache, with the common positive findings, migraine or anything, just do it. But you don't need to tell me what you are doing it, because I want to make it a bit real. So that I want to dig into all the details. You don't need to tell me what you are doing it. I want to explore my Socrates. And guys, how you are scoring me on? I want you to score me on. You'll be scoring on the Meftoza. You'll be scoring on the. I'm going to write it. Socrates of the headache. Socrates of the headache. Okay, sorry. I have to do it for all. Just 1 second. I'm just typing. Okay. You have to score me on the Socrates. How well I do the Socrates. Number 2, DDs. Red flags. And DDs, red flags. How many DDs I do? Okay. Red flags. And ICE. Do I do ICE or not? Do I do psychosocial or not? Yes, before that, Meftoza. I do ask Meftoza or not. Social or not. And management. So, Ilza, you have to tell me the setting yourself, create your own setting, and tell me your age, your gender, and do any of the scenario of the headache, any of the headache. I don't want to tell me what headache it is. I want to explore myself.
So it's GP setting.
Okay.
Patient is female. Her name is Lena.
Lena, okay.
She's 35 years old.
We have to put the timer as well.
I have left time.
Yes, please. The patient name is Lena. What's the age of patient?
35.
35-year-old. And Lena name and 35-year-old. Okay.
And it's GP setting.
Okay, no problem. Sound.
To the next section. Enter the room.
Hello, I'm Dr. Lapa, one of the doctor here in GP. Is this Lena?
Yeah.
Is this okay? I call you Lena? Nice meeting you, Lena. Can you please confirm your date of birth?
Yeah, it's 24th of May, 1995.
Thank you very much, Lena. Can you please tell me what seems to be the problem today?
Actually, doctor has severe headache.
Oh, I'm really sorry. I can see that you're within stress anyway. Bless you. I'm going to help you today, hopefully. Please tell me more about your headache.
What you want to know, doctor?
Can you please tell me when does it actually started?
Any time of the day.
Okay, anytime it can start, but actually when does it start the first time?
I think it's happening since last 2 months.
Oh,
I
last 2
had
months.
on and off.
Oh, okay. Have you tried any pain relief at
Like
all?
paracetamol.
Is it helping? Can you please touch with your finger with the headaches?
Well,
Here, in both
Yeah.
both sides. Headache is on the both sides. Okay. And anything make it better?
yeah, sometimes I notice whenever I'm in a dark room, I feel much better.
Okay, when you're in the dark room, you
Yeah.
feel better. And lights bothers you a lot. At the moment, lights is bothering you.
No, it's not that much that
Okay.
sometimes whenever there's loud music,
Oh, okay.
yeah, bright lights,
Bright lights
yeah,
also
they
hurts you a lot. Any position does change your headache or something?
No.
Okay. And anything seems to be make it better, like you mentioned, dark. Apart from that dark room, and
yeah, when there's more calm.
okay, good. Okay, is it going anywhere, moving anywhere else?
From the front to the back.
Front to the back. Okay. Anything else along with that,
Like what?
like vomiting or something?
No, I never vomit, but I feel sick.
You feel sick? Are you feeling sick at the moment as well? No. Can you please? Okay. Can you please quickly grade me your headache at the moment?
How I can grade it?
From the scale of 0 to 10, 0 being lowest and 10 being highest.
It's 8.
It's 8 at all, it's quite a lot, definitely. I'll make sure I'll get you the top of good pain relief for you, okay?
Thank you.
Okay, that's your brain. Don't worry, we'll help you. So a few more questions about that. By any chance, you spiking any temps, temperatures? No, no temperature. And you do have problem with. By any chance, have you vomited?
I told you.
Have you vomited? Not.
No.
I don't say. Okay, all right. And pain in your neck at the moment.
No.
Okay, bleeding in. Have you noticed your eyes are red or hurting?
Red? No.
No. Okay. And pain in your muscles, big muscles here? No. Okay. And by any chance, do you feel like your home heater or burning system is okay?
Yeah.
Everything is okay. And any particular time when this headache comes on? No. Okay. And now thinking about your general health, do you have any other medical condition at all?
No.
I need to ask you a question about your periods.
Yeah.
A standard question.
Yeah.
So when was your last period?
1 week ago.
1 week ago.
Yeah.
Normally your periods are normal.
Regular.
Is your habit related to your periods? Okay. Do you known to have any allergies?
No.
Any family history? I'm sorry to alarm you. And any family history of any tumor or something?
No. What you are saying?
I'm sorry. I just trying to rule out dangerous things. I don't want to talk to you, but I just want to rule out that, make sure everything okay with you. Okay. And you what do you do for a living?
I'm a teacher.
Yeah, good to know.
Yeah.
Well done. So you like teaching? You
Yeah.
like teaching. Good. Well, thinking about your lifestyle, do you, by any chance, do you drink alcohol? Do you smoke?
Not much.
Not much. Good. And I must commend you for healthy lifestyle. You do exercise as well?
No.
You
I
don't?
don't find that enough time.
Okay. Yeah, that's totally fine. We can consider in future as well. Okay. So, Rita, you mentioned it's been going on from last 2 months. Yes, so it must be affecting you your life.
Definitely, it's affecting my job. Sometimes I feel quite difficult to teach myself. But sometimes whenever I have this headache during my job hours, it's difficult for me.
Oh, I'll make sure that definitely we could find a solution for that. Okay.
Thank you so much.
Have you given any thought what could be the cause?
I don't know, doctor. Like you were asking about cancer. So is it something related
No,
to cancer?
I'm sorry to alarm you again. But by any chance, do you have your family, anyone has migraine or something? High blood pressure? Okay. I'll come to that point. At the moment, what question I asked, it don't seem like that you might have any cancer, something like that. You don't have any weight loss or lumps and bumps in the body. Thank you very much. So for today, do you have any particular worry apart from this headache?
I just want to get rid of that headache.
Oh,
It's so much.
okay, definitely. Okay. Anything particularly you're expecting from my side that I could do for you?
Yeah. Proper treatment for this headache.
Oh, definitely, I'll try my best. So at this point, Lita, I would like to take your observations. Okay.
2 minutes
And
remaining.
I would like to examine your, touch your, have a feel of your head, nose of your face and lips. Okay, front and back of your eye. Okay, and that's it. So, Lita, what you have told me, and according to my assessment, it seems like you might be having migraine or cluster headache, but we might need to differentiate it further. But at the moment, I'm more inclined toward migraine. Do you have an idea what migraine is?
No, doctor, please tell me more about it.
Migraine is one of the headache, which is usually unilateral, but you have it on the both sides. But you do have symptoms of that headache, migraine. But don't worry, we are going to help you with that, okay? For now, I'll give you the best pain relief. For now, I might give you some take from pain relief as well.
Okay, what is it?
For now, we'll start with the paracetamol.
I
and
took, doctor, I already took paracetamol.
Oh, I'm sorry. I'll try to give you aspirin now, 900 milligrams, so that 3 tablets, so that will help you. Plus, I'll give you some nasal spray of triptans.
Okay.
And if the headache goes worse, definitely will get some cut one from me. And but here I'll give you nasal one. Okay, is that okay with you, nasal spray? Before you go, I'd like to give you some reading material to know more about migraine. I want to have a follow-up with you to start you some prophylactic medicine for migraine as well. Okay, so those prophylactic medicines will help.
So do I need to take this medicine before my headache?
Yes, please. Prophylactic or this one?
Prophylactic.
Prophylactic, yes, for that one. That is basically preventive medicine.
So whenever I don't.
Yes, yes.
To take it.
Shall I repeat anything for you?
No.
Okay. And one more thing, try to make a diary of your triggers, like you mentioned, that music and everything. And definitely that will help. Definitely try to avoid.
What's the next section?
All right. Thank you very much, guys. So, Imza, you debrief yourself first, and
Sound is, the mentioned sound is
who mentioned that?
one of the.
Okay, sorry for that.
Okay, so please ask me if they.
Yes, sound. Everyone had a sound for it was low. At the moment, I'll treat for migraine as I mentioned that. The treatment for cluster headache and the migraine same, but
Cluster headache, we have eye symptoms, like there are a lot of eye discharge,
Mm.
pain at the back of the eye. So I don't think it's cluster headache.
it's not cluster. But I mentioned that because I don't know,
But
like
according to my opinion, we should give definite diagnosis, especially in these kinds of scenarios.
Mhm.
So we should move towards migraine, and then
Mhm.
I don't think
I did mention migraine that I'm more thinking
Yeah.
toward migraine.
plus have different symptoms and side effects.
Yes, I'll differentiate it. Cluster headache definitely. She's 35.
So she's 35. Headache is not related with her periods, so it's definitely migraine.
Mhm.
And please, guys, you should know that
It's
menstrual
give
migraine.
tense. We give
menstrual
tense.
Then this migraine. So we should be more concise with our diagnosis.
Okay, so I haven't said it because you don't have any
Okay.
symptoms. I tried to get okay, first you debrief that what are the positives and what things I can improve on. I'll open the sketch as well. So guys, let me share the screen and let me show you sketch for that, and we will in the meantime if I will debrief that as well. So this is a sketch. I will see that what things I have covered and what things I should have not. Ramesh is also here. Ramesh, if you have listened to the consultation, you can also start.
Like you are telling about all kind of headaches.
I have done all
Let
the.
me discuss one of them. In my exam,
Uh-huh.
they gave me menstrual migraine.
Mhm.
So accidentally, I mentioned premenstrual syndrome,
Mhm.
but we should tell them it's menstrual migraine. It's not premenstrual syndrome.
Mhm.
So when my result came, they froze my diagnosis. Okay.
So yeah.
So you should know that you don't need to mention premenstrual syndrome in case of menstrual migraine. You should be more specific.
Mhm.
It's menstrual migraine, not premenstrual syndrome.
Mhm.
Whenever the menstrual migraine will come.
Mhm. Okay.
Okay.
So let's debrief the consultation, and Ifza, you'll be scoring me on the part. So I'll try to do the Socrates. I try to be as gentle as possible with my patient. So I started with telling that, bless you, I'm sorry that you're in pain. I try to grade the pain. I try to think where is the pain going on. Definitely my consultation at some point when I was doing the DDs, I know I've tried to do a lot of DDs, but still I skipped few of those. Then, and especially related to the tumor, then I done it when I was about to manage that patient. So that part, I missed that part. So I missed few parts from the walking balance.
But
And you had, I did,
in 8 minutes, you can't like.
yeah,
ask
definitely,
everything. You need to
definitely,
be more specific, and you need to be like you need to hit the best things.
yes,
Your 8 minutes.
yes, definitely. We need to do that. So in that Meftosa part, Ifza, what do you think? What I have missed? Family history, yes, family
asked
history
about
of tumor, but I should have asked the family history of migraine as well.
You asked.
But I asked at the end because I should have asked together. So because I got panicked because the way she was simulating, yes, sometimes examiner do simulate that way.
Sometimes examiners seem so rude.
Because
we just
if you see her simulation, she tried to copy the way how they would do. What do you mean, doctor? What does that mean? What? Tell me what. So this is the way they would keep sometimes ask you question. What do you mean? Because they would get that thing that way, and they would say, "What do you mean, doctor? What? Like what?" So when I say anything medical, like what, doctor? So they would say that way. So they want to know that you have knowledge. So they are paid actors. So they would do that way. And you done well simulation, and you were successful in making me little go out of my consultation. And I tried to stay calm. And how do you feel about that consultation?
Zeeshan, you were very good in your consultation. I think whenever we think examiner is very rude, or sorry, simulator is very rude, and they are not giving us information as we are asking, so we should remain calm during that consultation. It's the point we can pass that scenario easily. We should not be like so much confused, or actually we try to ask everything.
Yeah,
but it's
definitely.
not correct.
And
Try to ask specific.
one more thing, guys, definitely, when I said, if they don't tell me which scenario I will be doing, you will be doing, that make me think of everything. If I would have know that this is migraine, because she said bilateral, yes, sometimes migraine could be bilateral as well. And there is one scenario in which there was a bilateral migraine. So
in children, it's mostly bilateral.
So yeah, so this is why, but she's 35. But I know one.
I give you clue of all other like
Yes,
how-
all other symptoms. I tried to rule out other things and everything, but when I was about to break the diagnosis, still I was concerned about cluster or migraine, but I went for the migraine because my gut feeling was going towards migraine. So this is that. So what else? What can be improved? So the consultation bias, if me tell myself that what I can improve on, stick to Maptosa more, ask, B, DDs could be improved, ask.
And you ask psychosocial, it's very good.
So psychosocial is must, ICE is must, I've done it. And in management, I could have get some more time to manage. If I could have more time, I would have tell her, I did mention reading material, but I was thinking not to rush. I was trying to get the champion check method as well. Anyway, thank you, Ibza. Anything else you want to add on?
Time was up.
All right.
You need to add leaflets and safety netting.
I did reading material. I said reading material. I said reading material. Okay. Well done. Thank you very much. So we'll continue with the Ramesh now. And yeah, okay. Thank you, Ibza. Thank you, Baba.
Thank you.
So what I would do now, guys, I want you to point out some mistakes in that consultation that can be improved. Then Ramesh, oh, hello Ramesh. You okay? I'm going to we're gonna do one scenario. Then after that, I will discuss that approach of the scenario. So Ramesh, just give me 1 second. Let me quickly stop sharing my screen. And Dr. Ramesh is with us. She is one of the doctor. She has. Can you introduce yourself? Did you introduce yesterday as well?
Yes, I was there yesterday as well. Hello, everyone. This is Ramesh, and I've cleared my PLAB, and I'm GMC registered. I'm currently searching for a job and looking forward to teaching you guys.
Yes, good. Thank you, Ramesh. The good thing about the Ramesh is that she knew everything, how to get the job. She done a couple of attachments, and she has a very brilliant doctor. She passed with 13 taken, and her consultation, most of the scenarios, like whenever she do simulate, very well. So her tune is very. I want you guys to see when she's delivering that information. The way the sweetness of voice and everything does count because the examiner will be listening to you. So they want to see that how you will be doing that. So, Ramesh, we got one scenario, two scenarios for you. We got two. Okay, so let me quickly see what scenarios. So it's related to the neurology again. And after that scenario, I'll discuss that approach. And guys, I want you to score her. She don't care whatever you score her because she's already a doctor, GMC registered doctor. So you can score her low as well. So, but make sure adopt the positive thing what she got. And we will debrief because there is always room of. I've been working in NHS like more than like 2 years or something, but still, whenever I do consultation, I always think it could have been better. So yes, this is the way. This is the approach you can do, and try to do consultations without any. Just read the approach and go for it. Go in front of mirror. Talk to your friends. Keep talking. So if you are antisocial or what we call introvert, if you want to pass your PLAB to become at least for 3 months extrovert, because this is only exam of talking. You need to make friends from all nationalities. Keep dropping text to everyone from different nationalities, especially Egyptians, Nigerian. They do have good emotional intelligence. Do practice with every bit of nationality. Everyone will give you good things, and you will learn from everyone's approach. And now let's move towards Ramesh. Ramesh, let me get a setting for you first. Let me see what scenarios we can do with you. Let's do first fit. Okay. Okay, you will be doctor in first fit. And
Okay.
this is very important scenario, guys. And just 1 second. Let me briefly tell the settings to the students who are attending this. and doctors. Well, sorry to call you students, you're doctors. Okay, so the setting would be A&E setting. I am 35-year-old. My name is Michael Brown. Okay, and I presented to the A&E with jerky movement or fitting. The jerky movement or fitting. Okay, the jerky movement or fitting. So, what is your task? Speak to the patient and address the concern. Okay. I will put on the timer. Guys, if you are enjoying the session, say yes. If not, tell us. So we'll play our music over here so that you enjoy. This one thing. If you can do binge watching Netflix, why don't you do binge PLAB too? Okay. You can start now.
Hello,
Hello.
this is Ramesh, one of the doctors in the emergency department. Could you please confirm your name and age for me?
My name is Michael Brown and my age is 35.
Is it okay if I call you Michael?
Yes, doc, you can call me Michael. That's okay. That's totally fine.
Okay, Michael, I can see from my notes that you are here with some jerky movements. Can you tell me a bit more about it?
Doctor, yeah, I was in the TV.